Hi, I'm Emily. I've been helping people move better, feel better, and gain confidence moving in every stage of their life for the last 15 years, and I look forward to helping you feel more confident too. Hi there, my name is Emily. I am excited to move with you today. Today, we are going to be beginning something that I am referring to as a move with me moment. We're going to do 7 days a week at 8:30 every morning. I'm going to give you a very quick 10-minute flow to get your blood flowing, make sure that you are feeling nice and ready to tackle the day. Every day we'll focus on a different topic and a different sort of movement. So today we are going to be working on strengthening the back muscles and making sure that we are alleviating any stiffness or pain, and talking about what we need to do to engage the muscles properly to protect our backs. So we're going to talk about deep core connection, which is so crucial when we are trying to protect our backs, and we're going to be talking about breath work and doing some movement to try to get ourselves nice and loose and get that blood flowing. So to start, we're going to talk about the proper breath to make sure that we are protecting our back and engaging those deep core muscles. We're going to inhale and we're going to exhale. And we're going to start just by bringing some awareness to where the breath is going in your body. We're going to make sure that when we take that breath in, we are filling our lungs as opposed to filling our belly. So no belly breathing here. We are expanding our rib cage and opening our rib cage 360 degrees around to accommodate those nice full lungs. And when we exhale, you're going to feel the muscles on the sides of your abdominal cavity moving in toward your midline, toward your belly button. You're going to feel all of the muscles that make up your pelvic floor, which sits right here and comes around like a sling, zipping up toward the respiratory diaphragm, which are those muscles that sit underneath the rib cage. So let's practice a couple of breaths with this. Inhale. Place your hands around your rib cage. Make sure that rib cage is opening. And exhale. Feel those muscles moving in toward your midline. Feel that pelvic floor zipping up toward your respiratory diaphragm, and feel a little bit of growth out the top of your crown, the center of your head. Inhale and exhale. Good. So this is the most supportive breath that we can do to make sure that we are protecting our back muscles, those multifidi, which are the spine stabilizing muscles, and to engage all of the deep core muscles so that we're protecting all of these things. When we are doing this, the next thing we're going to talk about is properly bracing the core. A lot of people, when they brace the core, they bear down. And what that means is that they're putting downward pressure on your pelvic floor. So we're going to learn how to properly brace the core using that zipped up pelvic floor and making sure that we are pulling those muscles in toward our spine instead of pushing down and creating a disconnection between the pelvic floor muscles and the respiratory diaphragm. So when we inhale and we exhale, and we're doing that diaphragmatic breath, and to brace the core, we're going to think about mimicking a cough. But when we're mimicking that cough, we want those muscles to tense and pull in and up toward our spine. So you don't want to be pushing your belly out. You want to be pulling it in toward your spine, zipping everything up. So let's do a couple of breaths, and then we're going to properly brace that core. Inhale. Exhale. And we're going to properly brace that core. And when we're tensing these muscles, we're pulling everything in and up toward our spine. You should still be able to breathe and talk and all of those different things. We're just setting those muscles up to support our deep core and to support our back. So now that you know how to properly brace the core, we're going to get into the mechanics of movement. We're going to talk about how to properly hinge at the hips. This is so crucial when we're talking about back work, because when we are bending over to lift something, the tendency that a lot of people have is that you pull your pelvis forward and you curl from there. And what that does is not only create a disconnection between the pelvic floor and the respiratory diaphragm, what it does is it actually shortens all the muscles in the back and it makes you more at risk for an injury. So when we are lifting things, I want you to place your hands on the tops of your thighs, and I want you to send that butt backwards. Send those sit bones backwards so that when we're bending, that's the proper hinge movement that you want to be engaging in. So you're going to protect your back in this fashion so that when you're lifting, your core can properly brace. So let's try that with a braced core. We're going to inhale. We're going to exhale. Send those sit bones back toward the wall behind you. Hands can glide down your legs. Let's pretend we have something lifted here and back up. Grab something that you can lift, either a dumbbell, a laundry basket, whatever you want, and place it on the ground. And I want you to practice inhaling, exhaling, brace that core, tense those muscles, pull them in and up toward your spine, and now sending the sit bones down. You're gonna grab that, lift it, and feel how much more supported you are when you're sending those sit bones behind you. So we can keep lifting, and you're not at risk of throwing your back out. I'm sure a lot of people have experienced that. So the more you practice this movement, you can set that off to the side, the more protected your back is going to be. We're going to get onto the floor now, and we are going to get into an all fours position. We're going to start to alleviate some of that stiffness, so you're going to tuck your toes under, and we're just going to bring our gaze through our legs toward our belly button, curling your spine so that you're gazing through your legs. And then you're going to keep your arms nice and straight, and you're going to arch your back up toward the ceiling, sending that breastbone down to the floor. We're just going to come gazing through our legs, curling the spine, arching that back, bringing it, and don't crunch your neck, so we're still sending that gaze forward. And then curling over our spine. Now I want you to just do some nice little hip circles that send it all the way into your spine, so that we're doing these movements, we're just creating a lot of flexibility in that spine. And then reverse it. We're doing nice spine circles here. So it's not just hip circles, we're curling, we're arching, we're feeling all of that flexibility. And now I want you to take your right hand, you're gonna reach through, bend that left elbow, and just grab that floor, pull yourself through, feel a little rotation in your spine. And left hand through, pulling through, feel a little rotation in your spine. If your back cracks, that's not necessarily a bad thing. We're not aiming for that, we're just getting that rotation in. Pulling through with your right hand, pulling through with your left hand. Excellent work. And now we're gonna actually sit back onto our sit bones. So you're gonna untuck your toes, you're gonna reach out, and you're gonna sit back on your heels. You can push through, stretching your whole upper back, those shoulder blades. Good. And now I want you to bring your fingertips forward, walk them out, and feel more of a stretch. And come back into all fours position. We're gonna still try to engage these deep core muscles here. We're gonna inhale, and we're gonna exhale, and we're gonna bring opposite arm, opposite leg up. So the right leg goes with the left leg. We're gonna send the right hand out, arm out, and we're maintaining nice square hips in this position, bracing that core. We're just really activating some deep core muscles with this. Everything is nice and slow. Breathing through it, bracing that core. There we go, good. Last one on this side. Bring it in. Untuck your toes, sit back on your heels, and then come forward with your hips. Sitting back on your heels and forward with your hips. Good. And now we're going to get into a lying down position. So you're gonna do almost like you're about to do a crunch. We're gonna lay down on our backs, and I want you to pay attention to feeling the connection of the back of the rib cage with the floor. Bring your feet a little bit closer to your bottom. Your feet are still hip width apart, and we're pressing through the backs of our arms. We're gonna inhale, we're gonna exhale. We're gonna brace that core, pulling those muscles in and up toward your spine. And all I want you to do is bring one leg up into a T. So it's gonna be perpendicular to your body and back down. We're doing a half tabletop here. Picture your leg like a table, still maintaining that connection. Backs of rib cage still driving into the floor. And back down, good. And back down, excellent. We're gonna just very gently maintain that connection, bring both legs up. And still bracing that core. Inhale, exhale. Interlace your hands behind your head. Keep those arms open wide. Inhale, exhale. Brace that core. Lower slowly, 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 slowly to the ground. And make sure that you are still maintaining that connection on the ground with the backs of your ribs in that position. It should have you feeling nice and connected. Every single Monday, we're gonna be tackling a different subject. Remember to try to brace the core throughout the day, and consistency is key, so the more you practice this, the more you move with me, you will start feeling better and more functional and get some confidence back so you can move without fear of throwing your back out, really maintaining a nice connected core. And I hope that you enjoy this throughout the day and feel a little looser. We will see you tomorrow for Tone Up Tuesday. We can't wait.